Hi all you adapters. Today we are joined with Eric Westman and we are on the low carb cruise, and we thought it would be a good time to chat about an important topic, and that topic is what Eric thinks the top 4 benefits of a low carb or keto program would be.
Probably the main reason people do keto, low carb, is for the extra energy and for the hunger control. There's just less appetite, so you're not bothered with worrying about eating so much. Or if you mean in terms of medical reasons, most people will do keto for the weight loss benefits. Once you become a fat-burning machine, your body starts burning its own fat really well, and so a lot of people think about this as a weight loss approach.
So that's counted as 1. So the weight loss is number 1.
Okay.
Give us another 3 more important factors that you see the biggest benefits in your clinic.
Very reliably, the blood sugar control is the next important thing.
Okay.
So if someone has diabetes, you can improve the diabetes and actually put it into remission. Or just if you have symptoms of blood sugars going up and down, that's the hunger, or even low blood sugar after eating meals, or getting sleepy after meals, that's a blood sugar regulation problem, and that gets better too.
And how about pre-diabetes? So people that come into your clinic that are presenting with pre-diabetes, when they go on this program, what happens to them?
Absolutely. The pre-diabetes just means it's a elevated blood sugar, but it doesn't meet the criteria of full-blown diabetes. So pre-diabetes gets better as well.
And typically, what do you find, give us a generalization. Somebody comes into your clinic, they already been a type 2 diabetic for a couple of years already, they're on medication, and they embark on this program. What is the typical patient see?
Well, everyone will get better in terms of the diabetes. How fast it gets better depends on how long they've had it and what kind of medications they're on. But we've seen improvements in the first day of changing the diet. So you have to be very careful and have medical supervision if you're on medications for diabetes. But it gets better very quickly. In a series or a survey we did of some patients, it was an average of about 7 weeks to get people off of insulin in that time. And many of these people have been on insulin for 10 years.
Okay, and so would you give us an example of the success, or give us a percentage that you think you are able to successfully get people to either reduce or get off their medication?
Well, everyone can reduce or get off medication.
Okay.
That's 100%.
Okay, well,
yeah.
So a lot of people didn't know that, and it's not information that you are regularly told through certain channels, so it's good to know. So that's 2. We've got weight loss, we've got diabetes and sugar control. What is the 3rd one?
Well, there's a new understanding of what causes heart disease and atherosclerosis, or hardening of the arteries. And that's called the metabolic syndrome. If you have high triglyceride, low good cholesterol, or HDL, if you have an elevated blood sugar, but it's not quite diabetes, if you have an elevated blood pressure, but it's not quite high blood pressure, this is called the metabolic syndrome. So you have to have a special test done by your doctor to figure out if you have it. But this new view of what causes heart disease, that gets better. In fact, the best treatment for metabolic syndrome, diet-wise, is a low-carb ketogenic diet.
Okay, so that's 3. That's another misconception, because most people think that if they embark on a keto or low-carb diet that includes eating some fats, that their heart condition would get worse. So that's the 3rd myth that gets debunked, or has been proven to be debunked while following a ketogenic or low-carb type of program. What is number 4?
Well, the most unrecognized benefit of a keto or low-carb ketogenic diet is the elimination of heartburn. I see it 98%. People are off medications, the heartburn's gone, and it's not the reason people come to me for it, the recognized reasons, the diabetes, the weight loss,
metabolic syndrome.
The most important thing in many people's lives is the elimination of heartburn. So if there's one thing, if there's a top 10 of the unknown things that the keto diet does, is it eliminates heartburn.
All right, well, that is just incredible. Like I said, a lot of things that we are not taught and we are not told. So those are 4 incredible benefits of following a keto or low-carb lifestyle. And to recap, it is weight loss, it is blood sugar control, it's metabolic syndrome, and it is heartburn. So those are the 4. Thank you so much. I think we're going to hopefully enlighten a few more people as to what a ketogenic or low-carb program can do for you. Thank you.
Thank you.